I was born here in Sioux Falls. I grew up on a small acreage west of town. Went to high school in Lenox. Graduated there, went down to USD for my undergrad. I was a biology major, applied to medical school, and was down in Kansas City for that. And then I had the opportunity to shadow a few orthopedic surgeons here in town, and was kind of blown away. The combination of medicine, being able to work with your hands and taking something that was, for lack of better terms, broken down, joints or broken bones, stuff like that, and be able to repair that, put that back together, and use your hands for that whole process was very, very enriching. I thought that was something that would be a perfect career path for me. A few years into my residency, I kind of reached out to Avera and saw if there was opportunity to come back home and kind of keeping in touch with them. I think their philosophy of care really kind of parallels with mine. As long as we have a building and a physician to treat someone, we're here and we're going to take care of that patient. I really think that kind of parallels with the way I want to treat the community as well. I like to take a really team-based approach and make sure that although I'm there to help guide and come up with potential solutions and recommendations, ultimately it's the patient's decision and their choice and how they want to go about their treatment plan. And I'm a very conservative surgeon, and where I want to make sure that we exhaust all conservative option plans before we even have a conversation about surgery. I think there's a lot of treatment options out there that will do well for patients, and we don't have to jump right to any discussion about surgery right away. I think what kind of made me go towards the joint reconstruction and revision process was seeing patients that come in that really had a low quality of life over the last few years just because they were debilitated by their joint pain, and being able to see them weeks after the procedure and get back to a lifestyle that they enjoyed, whether it was activities for golfing or just low impact sporting activities, stuff like that, getting back out in the field for harvest, stuff like that. If it's something that they need to do, be able to get back in their career, or even hanging out with kids or grandkids, stuff like that. It's just quality of life stuff that really you can make an impact on. It's very rewarding to see them come back after that. I really enjoyed hunting growing up. I did a lot of that when I was back home. After I moved away, unfortunately, I didn't get to do that as much. So now that I'm back home, I'm really looking forward to get back out in the field and getting back into the hunting. I really got into woodworking too. Really got into live edge furniture, creating slab work and welding the frames for that, and building tables, coffee tables, desks, stuff like that. Any orthopedic surgeon on the street, they'll probably say, "Oh yeah, I like my job because I work with my hands." And although it's a cliche, it is very true. People who work with my hands every day, and doing that in my job is something that's really integral to to the career, and I don't know if I would really enjoy my career if I wasn't able to work with my hands.